Thank you for joining this Life and Laws community conversation. Many families feel unprepared for the emotional and practical challenges that come when a loved one is nearing the end of life. In my work helping families after a loss through probate and estate matters, I often see how overwhelmed people feel and how many questions they wish they had asked earlier. The purpose of this conversation is simply to help families feel more informed and less alone during that time. Today, we're joined by Dr. Jordan Sall, the medical director of Emmanuel Hospice. He works with families through hospice care and supports them during one of the most important and difficult transitions of a family that a family can face. Thank you, Dr. Sall, for being here and for the work that you do for families in our community. I'm going to ask you a few questions to share with our community. And I guess to start, could you briefly share with us how you entered your role in the hospice sphere?
Yeah, absolutely. So my name is Jordan. I've got a background in acute care medicine. So I like to say I grew up in that space. So I did my training through medical school, residency training. Spent the beginning of my career actually taking care of people in the hospital with the focus of curative medicine and striving to overcome health challenges. During that time, I really developed a passion for getting to know my patients, helping them navigate difficult decisions, and then at times making difficult decisions to kind of pivot. Um, that's something a physician should always be striving to do, but I felt like it was a skill set that I actually like to spend time on. So after a little over 10 years practicing in that space, I had the opportunity to go back and I got my MBA and happened to land it after that time. It landed a leadership position over continuing care with a past employer. And in that space, I helped oversee our hospice department. That really continued to fuel my passion for serving these patients. And as I got into that space, I started to develop a bit of a clinical niche for serving there as well. So since that time, it's been kind of where I've poured my time and attention to, and something that I've really grown passionate about helping people. It's something that, when done well, can have a lasting impact on patients and families, and provide just tremendous value. So something I really enjoy.
Great. And I guess even before that, if you think like superheroes have sort of an origin story, you're sort of a superhero of hospice, right? So
Mhm.
you have kind of an origin story. Is there anything that stands out in your life that just drew you to this type of work, or was it the work that you did, in your clinicals and medical school that opened your eyes to it?
Yeah. So what drew me to medicine initially was my dad had a pretty massive heart attack when I was just a little kid, and that drew me into medicine. And then it was my time serving in that space of curative medicine where I developed the passion for hospice care. Um, then in addition to that, my mother-in-law is a attorney who helps serve people getting their estates in a fair. So it's on both sides of the equation, something that I'm really just extremely passionate about. So it's something that is part of our home life. It's something that is part of my professional life, and I think that that blend of experiences has really just made it something that I feel very strongly for. And I think throughout my time, some of the patients who I felt most connected with were not always the patients that I created a cure for, or that we did a procedure and they like had a great outcome. It was actually patients and families who had a disease they couldn't overcome, but we were able to work with them to provide um, compassion. We were able to provide a soft landing spot for them, and just to be able to see the impact that that has when it's done well is it just makes me really happy, and something that I feel really good about.
Yeah, that's a great kind of great segue into what we're talking about here today is the intersection between, estate planning and probate, what we do here, and then what you do.
Hmm.
Um, and, I guess could you share a little bit about what that work is, the hospice work, helping support the families during the end of life journey, helping them create um, the best possible ending to the story when they know the ending of their story is coming soon.
Yeah, absolutely, and that's very well said. So our team tries to take a holistic approach. One of the the really nice things about hospice is it really is interdisciplinary, meaning our team comprises physicians, social workers, chaplains, spiritual care workers. We have multidisciplinary musical therapists, art therapists. I mean, we really provide the gamut of offerings to our patients. And throughout that process, we certainly try to take care of their health and their well-being in terms of how they feel and pain relief and, treating their anxiety and things of that nature. However, we also try to help connect them with resources in our community, such as your office, that are able to help them put their affairs in order so that their loved ones are taken care of throughout this process as well.
And there, with so many different options available, most of our clients don't even know the full gamut of it. But
Hmm.
addition to that, what do most families often misunderstand about end of life care or hospice support that you've seen?
Yeah, I think the one that's the most obvious is the timing of when to get the services involved. I think most people historically think of like very end of life, like the moments leading to death, and like they're laying in a hospital bed and they're, at that point just, counting down the minutes. However, the hospice benefit and getting a hospice organization involved is actually most useful the earlier that they're involved. And certainly there are some criteria that we have to screen for to make sure patients are eligible as a benefit. However, when eligible, the families that get the most benefit actually use it for longer periods of time. And we do in fact have patients that um, can and often do use us for more than 6 months. We have patients who come on and end up being, too well physically or improve enough that they're able to come off of hospice. Um, Throughout that process, we try to help them get all their affairs in order. And so, of course, the longer we're able to be with them, the more impact we can have, the more services we can provide, and the more connections we can make to other services in the community.
Great. And I think, along those same lines of, and we see that as well, people holding off. And I think
Hmm.
what I've seen and kind of heard and observed in my practice is, the hospice is seen from when you transition from having hope to hopelessness. And I think you've explained that people graduate hospice, they get better.
Hmm.
Having that extra support sometimes gets people over that hump. Um,
Exactly.
and, and what we've seen in our practice is when people get the news, right? You've got a terminal condition,
Hmm.
you've got X number of months, years, whatever to live. um, the surrounding family sometimes goes into anticipatory grief, or they're grieving the
100%.
future loss, and it's kind of an awkward situation for us, because we're trying to support the people through the process, try to
Absolutely.
focus on the process. So I'm curious, how should it be handled? That kind of that awkward transition. I've tried to be all about business, but at the same time, you want to be warm and let the people know you're there to support them.
Yeah.
But I don't want to get pulled into the grief process when there's still work to be done. So I'm not sure if I'm doing it wrong, or if you've got some suggestions there, that would be great.
No, yeah, I appreciate that. It's a really good question. I mean, one of the most common misunderstandings in hospice is that giving up. And in reality, hospice is about shifting our focus from trying to cure disease at all costs to prioritizing comfort, dignity, and quality of life. Many families are surprised to learn that hospice can actually mean more than support, more than communication. It's more time spent meaningfully together with their loved ones, with their family, and doing that with the peace of mind of knowing that their affairs in order. It is often a journey to help patients and families through that process, and I think the one of my passions is being able to um, have conversations like this where we can have this discussion before somebody has to make the decision of whether to use hospice, because in those moments it is more difficult, right? Because they're processing, their hearts are heavy. Um, but we also firmly believe that having this education ahead of time, hopefully patients and families are already ready to make that decision or are excited to have that as a benefit when it's time. I think most people think in terms of minutes and hours of life, but really like I love to think in terms of quality and comfort. And so that's something that I know that we do very well. And it's meaningful when we're able to partner with, folks in the community like such as yourself that understand that and are able to work alongside us to have a shared passion for taking care of people and making things easier for them.
Thank you. And in our practice, we try to focus on the process, but there's always going to be some emotional
Mhm.
challenge. Families, you see anger, you see people going numb, you see all
Yeah.
sorts of things. What range of emotions are, quote unquote, normal, and how does your staff help support people when they see those maybe more amplified than they should be, where you obviously somebody needs some support getting through these emotions that they're facing.
Yeah, absolutely. I mean, first of all, any emotional response is normal in that circumstance. I think I've seen a very wide range of them. So I just knowing how many different people and personalities are out there, all responses are normal. I think the ones that I tend to see the most often, um, uncertainty about what to expect.
Mhm.
I think guilt, feeling like they're not doing enough or that they're doing too much, and then fear of making the wrong decision. And I tend to see that folks who are prepared for these discussions well before they're necessary make that adjustment easier. So when they have a well spelled out, will or trust that outlines when they've had a detailed conversation with a loved one about what they would want done in particular circumstances really tends to ease that for people. I think a lot of these fears and uncertainties tend to arise because we don't know, because when we're having good days, we are afraid to have these conversations because we don't want to mellow the mood and we don't want to bring our highs down. So I'm a big believer that having these conversations when things are going well is very important, because it does make these transitions much, much easier. I think one of our key roles is to walk along families through the uncertainty, help them feel supported and reassured, and know that we're going to do everything we can to honor their loved ones. And I think having cared for patients in high acuity hospital settings earlier in my career, I've seen how overwhelming these moments can be. So in hospice, we actively try to slow things down and make sure families don't feel pressured, stressed, or alone in making these decisions.
That's great. I guess going back a little bit to the transition from day-to-day caregiving to considering, a hospice
Hmm.
situation. A lot of our clients are in a day-to-day caregiving situation, kind of
Hmm.
like, if you see somebody every day, there's not
Yeah,
a clear sign that it's coming. Like,
yeah,
are there breadcrumbs that families, the caregiver might not notice, that the surrounding family, maybe they'll notice and say, hey, maybe we should talk to the doctor about these, because maybe they don't seem serious because they're happening every day and they're not really getting that much worse to the caregiver.
yeah, yeah. That's really hard. I mean, it's like when you're on the other side of things and you've got little kids at home and they're growing up and changing and you don't see it. And then you have family that comes out of town and they're like, oh, they're getting so big. I think that daily exposure really kind of muffles the slow changes that are happening. And that can be very difficult. So I think for me, it's about having consistent, open dialogue about this throughout the process. I mean, I certainly um, love when primary care physicians are involved in this process to help identify and have these difficult conversations. When the specialty physicians, the cardiologists, the pulmonologists, the oncologists are involved. But truly, if there's any doubt that a loved one is declining, we much prefer to meet with patients and families multiple times before it's time or before it's necessary to help walk through them because that's really what we're here for. So my biggest recommendations to patients and families is if they're seeing anything that is resembling a decline, it's a good time to ask if it's appropriate to have a conversation. And I hope to shift the narrative from one of fear and uncertainty and having to do it at the last minute to one that's proactive and empowering so that patients and families are making this as a choice when they're ready early than having to make a difficult decision late and be uncertain.
Right. And yeah, that's exactly true. I think in people's minds, they picture a hospice nurse and, the Grim Reaper kind of the same. Like they're coming, it's the end is
Hmm.
near. So, back to the waiting too long. And I think part of the waiting too long is the lack of at least the perception of the lack of choice, right?
Yeah.
So people feel like they're being sent or sentenced to hospice rather than it being a choice,
Yeah. That's a really good way to
changing
put
the
it.
story. Um, how can people that are supporting like a caregiver, the primary caregiver a lot of times is a
Hmm.
spouse, the children sometimes come in and help. How do you support encouraging, hey, take a load off of yourself. We can bring in this hospice support without it being, the scary hospice word, so that we don't the clients, the families don't get to the point where they feel like they've got no other choice other than hospice, and then it's just a rush decision at the end.
Yeah. I mean, part of that is what we do every day in terms of making sure we're caring for people in the community that are getting the benefit early. So it's shifting the focus from a reactive to a proactive approach. And I think when people know someone else who was well cared for early in the process and had benefit from it, it's much easier to see that, believe it, and trust it. So some of that's foundational in the work that we're doing every day because the power of being known and the power of experience is huge. So when somebody has a friend or a family member who's been on service and they had a great benefit from it, of course that's going to carry a lot of weight because people see that, and so it becomes a generational transition. So we're certainly trying to make an impact with our current generation, but we're also trying to have a generational impact whereby the next generation and then our generation and my kids' generation are all subsequently more familiarized and more comfortable with the process. But we also note that there are, cultural, geographical, financial differences in the way people view this, and so we do our very best to meet people where they are. But again, like I think the biggest thing is having these generational impacts where it becomes more comfortable, more confident. And I think when there are hospice organizations like Emmanuel that take that approach and are truly there to serve patients and have good partnerships in the community such as yours, it's much easier to have that impact, albeit slower than I'd prefer. It's the most genuine and like real approach to really making an impact.
Yeah, and I think over the 25 plus years that I've been doing this, I've seen some of those changes, right?
Hmm.
So you go to funerals, and it's pretty common to hear people sing the praises of the hospice people, thank them personally for the
Hmm.
care that they've given. I ran into my grandmother's hospice nurse, I don't know, probably 20 years after she died,
Oh
and
wow.
they remembered, oh, a name like Eyestone, it's memorable. There's not a whole lot of us, and we're related to Ruth. Like, yeah, that was my grandma, and then just had a nice conversation.
Oh
It
man.
surprised me that so many years had gone by, and she wasn't in hospice
Yeah.
very long, but you know, they care. I guess is I'm not asking a question. They truly care, and it's
100%.
good, to see that happen. Um, and then, as people are in hospice, what are some uh, practical things to help them the families feel more prepared as it progresses? I know everybody's got a different path or a different timeline, but
Hmm.
what should they be doing to prepare themselves to, enter the hospice scene at various levels?
Yeah, yeah. So I mean, on our end, the biggest thing is clear communication is everything, and because families are going to feel most prepared when they are able to understand or anticipate what changes are going to be expected physically, when they understand how symptoms will be managed and who to call. I think for families that are entering this space, having an understanding of their loved one's wishes ahead of time is probably
Mhm.
the single most important thing because it takes that caregiver fatigue and helps compartmentalize it, because I think it's much easier for people to act when they are comfortable and confident that they're acting in the best wishes of family. I think where I see people have the biggest struggles or the biggest challenges making decisions is when they're uncertain about what would be best or what decisions would best honor. I feel like I see people feel a weight off of their shoulders when they're simply acting as an advocate for their family members. And so we never want somebody to feel like they're having to make difficult decisions. We just want them to be able to be an advocate for their loved ones. It transitions from one of decision fatigue to one that allows them to really just be there as a loved one. And what we want to do is take the weight of the caregiving as much off of their shoulders as possible, so that rather than having to be caretaker, husband, brother, sister, whatever, they're able to really just be there and be that loved one that helps support them and be with them and be present as much as possible. And when we're able to do that, it's a really unique relationship that we can set up with families to help care for people.
Yeah, and I think having that knowledge ahead of time, just like you said, is tremendous. It's not a situation where you want to go put the burden on the hospice provider or nurse to say, what should I do?
Hmm.
What does everybody else do? I mean, everybody's so different. I mean, you think about pain management. Some
Hmm.
people, they get a sliver and they can't go to work for a week. And other people, they muscle through it. And where do you want to fall on that spectrum? Do you
Yeah.
want to be sedated and have the end of your life be peaceful to sleep, or do you want to kind of feel like you're fighting through it, or
Hmm.
being alert for the family, or have periods through the day? I mean, there's those kind of details. I think that great hospice organizations like your own can explain to the families and give them permission. I think that's part of it, giving them permission to
100%.
make the right choice for their family. Um, and what resources are available. When I heard about some of the hospice services you guys offered, I was like, wow, it's like almost like a cruise director. Like, you can take this path or this path or
Yeah.
this excursion. So what support or services do people like myself, even I've been doing this for 25 years,
Hmm.
and I didn't realize some of the things were even available. What types of things that you offer are surprise to families that they don't realize and they don't even know they can ask for?
Yeah. So I think depending on their level of familiarity, many families don't, I think, really truly understand how comprehensive hospice support is. And I'm lucky to work for an organization that prioritizes that above anything else, or it's really a group that's dedicated to patients and families. So among the things that some people are familiar with, but not everybody, we have a robust nursing support and symptom management, of course, that's overseen and directed by physicians and nurse practitioners. We have social work support that help with emotional and logistical needs at the end of life, making connections with community partners such as your own. We have spiritual care for those that are preferring that. We don't push that on anybody who doesn't want it. So we are, a interfaith organization, and we're there to support people who want that. But we have patients and families who tell us that's not something they want. Um, and then we have bereavement support also for after a patient and family pass, but also for while they're alive, because as you mentioned earlier, there's the anticipatory grief of losing a loved one, anticipatory grief for the patient who's grieving their own circumstances, and then we help navigate medications, equipment, the home environment, getting that arranged, all the logistical challenges. But we have music therapy, art therapy, we have immersive therapy, we have interactive 3D. We make wishes come true for patients and families. I actually have recently taken care of somebody whose last wish was to go on a cruise with their caregiver, and they went on a Royal Caribbean cruise, and that was made possible through the work of a lot of people. And we were able to do that within about a month of this patient really not being able to, wouldn't have been able to participate if we had waited. So that was something where I was just so happy that patient came to us when they did, because we were able to make that happen just before they really started to decline to the point where now they're bed bound and confined to their home. So it was just that like really heartwarming story where it was like, yes, like I would love to take care of these people, all anybody who's ready to take care, to accept the services as early as possible because our options are just so immense when we're able to make it happen early. So it is a really cool thing. We'll say Emmanuel offers more than most hospices does, and that's part of what I feel so fortunate to be a part of this team because it does really mend itself to patients and individual preferences and really offer a lot of support in a way that connects the best.
And what's a way that we can share with our clients and their families how they can find out about these resources that you offer and compare those to the hospice services that they've been recommended, by the hospital or provider that they're working with to make sure that they're in the right spot.
Can you say that question one more time?
So how can what's the best way for us to share um, resources? Like, do you have websites? Should people call?
Yeah.
What's the best way to get?
Yeah. So we do have that on our website, but we love to have early conversations. A phone call is never obligatory. We love to talk to anybody who has questions or wants to understand. So those are both great options. And then if you have a trusted loved one that has used our services, hopefully they could speak kindly to the services they had. But we do have a comprehensive listing on our website, and our team that receives phone calls from people love to talk through what options we have, what we can offer, and how we could best serve in particular circumstances. And again, it's non-obligatory.
And I guess I'm assuming maybe I'm wrong. I'm assuming that you don't have Royal Caribbean Cruise listed on your website as an option. So
Yeah,
just letting people know it doesn't hurt to ask, right? So the worst that you guys could say is no, we can't make that happen, but this is the closest we can get. Is that a fair way to put it?
yeah, absolutely. And we pride ourselves in getting to know patients and families as well, so that we can have those conversations once we get to know them. Our team of social workers, nurses, physicians, chaplains love to get to know people and ask, what things are most important to them and what would fill their cup up. And yes, there's, certainly differences in physical abilities at the end of life. But we love having those conversations, and we have some really good community partners that help make some of these things happen with alongside us.
Well, that's great. Just, I guess my last question here for you is looking back on all the families you've helped or that you've been a part of helping,
Hmm.
what is something that you wish more people understood earlier about the end of life journey or hospice?
Yeah. Um, I think just how incredibly meaningful it is to provide this level of care here locally. I think, we're always eager to connect, collaborate, and support families in a way that feels personal, responsive, and grounded in trust. The longer I've gotten into this work, I just hope that people know that it really is individualized and holistic care. It doesn't need to be one size fits all. And if they ever have questions, we'd rather have a conversation and figure out a pathway forward for somebody, even if it doesn't include using our services, than to not be a part of that. I think that our team has a unique set of experiences and skill sets that allows us to help navigate that alongside with patients and families. And then, of course, conversations like today's where we're able to, work with other folks that work in this space and understand and have, the experience of helping people navigate is really meaningful because it provides meaningful connection. It helps build trust within a community because just like if you get a referral for a financial planner, when you know somebody and trust somebody that's used it before, it's much easier to let your guard down and really get the benefit from that. So we want people to know that we're here to serve. We love having conversations, and we don't ever want somebody to be afraid to call and just be able to talk through the initial parts of it.
Yeah, and I think that that's great. And one thing that we talk about here, and I think it might carry over to what you do as well, is we tell people if you don't make a choice, sometimes a choice is going to be made for you. In our world, if you don't
Hmm.
choose to use probate avoidance techniques, the court is going to choose the route for you based on the
Yep.
statute. And, if you don't choose how the end of life for yourself is going to carry out, I mean, the path is going to be chosen for you. You may
Correct.
not, end life in an ambulance, racing, trying to get the last 5 minutes. But you've spent the last 6 months just worrying about that day coming rather than having a structured way of planning out your days, which I think is what hospice does for people.
Yeah, absolutely. That's very well said, Sean.
Well, I want to thank you so much for sharing your experience and the perspective you've had today. For the listeners at home, if you'd like a short summary of the insights shared in this conversation, including hospice guidance and helpful resources for families and friends, you can request it. We'll drop a link with this video, and we'll give you the opportunity to add your email, and we can send you some information privately as well. The work hospice professionals do for families during this time is incredibly meaningful, and I know that many families will benefit from hearing these insights. If you or someone you love is walking through this experience, know that there are professionals like Dr. Sall and his support team that can give you resources to help you navigate through this journey. And thank you again, Doctor.
I really appreciate it. Thanks for the time, Sean.